listen to this video. Now, this is the government, not the government. Yes, the government part. They have asked the ombuds to actually go and do investigation in the hospitals of Northern Cape. Okay, now he's going to give us just a brief of what they have found, which is not impressive actually, and it's not a good looking. And to be honest with you, seems like somebody somewhere is not doing their job. Okay, now I've taken him from minute number 11. You can go at the early, you can go not at the early, what am I saying, you can go earlier or start with the video actually and listen. Okay, but I want us to take a listen to what he's going to say. There is some sentence or some statement that she's going to say, that he is going to say regarding the training of the people in these hospitals. That is going to be one of their recommendations, you know, and all of it. Now, let's take a listen to this. Stay until the end, guys, please, because I want to say some very important things here. It's very important. Please stay with me until the end. Let's go.
Here today, and is bedridden. There were other findings that the Health Ombud team noted, and one was superfluous furniture procurement, procurement of golf carts, purchase of inappropriate hospital beds, delay in commissioning of the ECT machine, and that there were no clinical audits in both hospitals, and the overcrowding at the Robert Mangaliso Sobukwe Hospital Accident and Emergency Department. Now follow the recommendations. The recommendations are grouped in my mind on human resources, equipment, infrastructure, and above all the training and competence of the staff. Now, first of all, we say that the MEC of the Cape, Northern Cape, and the head of department of the Northern Cape Health Department must address the staff shortage urgently by recruiting staff and be on a retention drive. They must appoint non-South Africans where there are no South Africans who qualify for those vacancies.
All I can say with this, okay, I don't want to be dramatic and anything, okay, but all I can say based on the statement, okay, as their recommendation, right, they are not saying, and I repeat this, they are not saying those who are supposed to be employing those people that they are looking for, right, to beef up the staff in these hospitals, okay? They are not telling them to go out there and from the beginning or from the point of starting the process of wanting to employ some people to beef up the staff, and then they go immediately and look for non-South Africans. No, they are saying to them, when you don't find, if it happens that you don't find, right, if it happens that you don't find any qualified South Africans that are supposed to be in those positions that you are looking people for, then you can go and look for who? For non-South Africans. All right. Now, this message is going to go to those South Africans. We always complain, right, about foreigners, whatever, non-South African, whatever, right? But I want you guys to understand one thing. This is an announcement. This is a recommendation. Obviously, chances are they are going to do it. They are going to beef up the staff, and they will be looking for you, right? They will be looking for you so that you can be able to actually go there and work there, right? Now, chances are, again, that when they are busy looking for people to work in these hospitals, chances are they might find people who are also overqualified. Maybe they are looking for people who are going to be nurses there and all of that. And then maybe some of them, because sometimes when it comes to us, South Africans, when you are overqualified and they tell you, they say there is a position in this field, we want you to come and just be a nurse there and everything. And when you look at your qualifications, you see that actually I am more than qualified for this, or I'm overqualified for this position. And then you don't take that position. And you forget that sometimes when things begin or when things start, they start small. You start where you are not pleased to start, but at the end of the day, you might end up somewhere. I'm just saying this so that you guys... Now, this announcement, guys, it's very important because they are telling us that if they don't find you South Africans out there, and if you're going to hide just because you are overqualified, or maybe you don't want to work there because you are more than qualified, or you are overqualified, they will go and look for foreigners. Later in life, you'll come back and say they are employing people that are not South Africans. Okay? And that is very important. All right? And unfortunately, guys, there is no way that the government or people who are employing people in these hospitals, when they are looking for people and they don't find non-South Africans, okay? And then, okay, they don't find South Africans and then they employed non-South Africans, and then you come and complain because they have been looking. They are going to put posts out there and say, we are looking for nurses. And some of you won't take those opportunities because you will say to yourself, I cannot be a nurse. And when they employ these guys, and then we come running and complaining. Okay? Now, I want to next time, in 2 years, 3 years, 4 years, when this thing maybe starts and then people, they complain in parliament and say, yeah, you are employing foreigners, whatever, you are employing non-South Africans, whatever, you must remember this video. You must remember, you must come back to this video again, okay? To say they did say that if they don't find South Africans, and also the system, those who will be employing those people, they must make sure that they prioritize until you exhaust your search of South Africans and you don't find them. And I would actually love it if they do that, and then maybe they don't find South Africans, they can come back and make a statement or make a press conference, even if it's 30 minutes press conference. They just tell people that we have put some posts, we are not finding South Africans. And we are thinking of going for non-South Africans because South Africans are not there. And maybe if you can, then you can give them maybe a week and say, again, we will put again for the whole week, we want South Africans to come and become nurses here. Please apply. And if they don't apply, I wouldn't have a problem if you employ non-South Africans because South Africans are not there. I would accept it. But this thing of doing things underground, you are not telling us what is going on, then you come in parliament, no, we have put posts, since South Africans, they didn't apply. And then you come, because guys, I don't want to lie to you, okay? When you say that you want to prioritize South Africans, in other words, when you do it to the T, you do it until the last moment. You are like, listen guys, we don't have a choice. We have to employ because we want to beef up the staff. The time is going. Okay? That's what I am saying.
Thank you very much, Program Director. Let me say protocols have been established.
End of safety.
I don't have to repeat that, but to greet my colleagues, the Deputy Minister of Health, Dr. Pasha, and the MEC for Health in the Northern Cape, Mr. Leguena, and the Health Ombud, Professor Taole Mokwena, and all protocols observed, as I said. Once more, the Health Ombud for many years ago when we established this office, because it was the first time that South Africa get the Health Ombud. When we appointed Professor Makgoba, I was asked what this Health Ombud means.
I'm sorry guys, this phrase paraphrasing, it's not me, ne? It's just a video.
The office going to do. My simple answer was that we are establishing to be a public protector of health, to protect healthcare system, and I'm once more happy that this is happening, Prof. The first action of the Ombud was unfortunately life is demanding, as you all know, and the Health Ombud then, Professor Malarapidu Mahoba, did his best, and then from there, Professor Mukwena came in. This performance from the Ombud never stopped. It is serving the purpose for which it was established. Prof, if I was a physician in practice and was to make a diagnosis to these two hospitals, I will diagnose them as having multi-system organ failure. That's what I would do if it was a human being. Multi-system organ failure meaning there is no organ that is functioning. Because basically, it's clear that there is a problem of management. And in quite a number of our hospitals, we do find that problem of management, and we try our best to deal with it. But I'm more alarmed to find that even clinical management is poor by doctors who are trained. If you remember, Prof, when you released Charlotte McCracken, not Charlotte McCracken, my apologies, the Helen Joseph report, there were 7 complaints lodged with you. 5 of the complaints you dismissed them because it was clinical management, which was found to be very adequate by both doctors and nurses. The only problems that you upheld was the issue of infrastructure and the upkeep of the hospital. Now, in this case, that's not the case. Even the doctors did not do, I can't imagine, I haven't practiced for a long time, but I can't imagine a doctor finding a medically ill patient with pneumonia and referred him back to mental, without treating the pneumonia. That is unheard of. Now, what do we make of this? What do we make of this? Because all doctors and nurses are trained in the same institutions in the country. How come will doctors there have acted in this way? They come from the same medical schools which you all attended. So my conclusion is poor leadership with not working together. And I could guess, it's not in your report, I could guess that they don't even have management meetings, even mortality meetings in the mornings. I don't think they are there. Because if they were, some of these things could have been picked up. So it means going to restart from the scratch. And I'm particularly disappointed about the Robert Mangaliso Sobuke Hospital.
Okay, so first of all, Mr. Mtswale talks about it's a failure of management. Okay, now what we need to understand, I believe, is that ministers, I believe that they are not managers. That's why they have got managers that they have to appoint. Okay, I don't know whether they are appointed by the minister or anything like that, but however it does happen, the ministers, the only thing they do is just to oversee. That means they make sure that every system is there, everything that's supposed to be there is there. Okay, so, and then they go and then they expect and they hope that those guys that they have put there, at least they will do the job, okay? It's not their thing that every day now they have to be going to hospitals because they've got managers. Otherwise, then the managers, in other words, they will not be doing what they're supposed to. In other words, their presence there won't be actually necessary if the ministers every day they go there and check. The reason why they put managers, it's because they trust that the managers, they will do what they're supposed to be doing. In this case, it seems like people are not doing what they're supposed to be doing. Okay? They are not doing what they're supposed to be doing. And they also suggest that actually it seems like they don't even have meetings every morning to speak about what exactly they need to do, what is the progress, and also what have you done. You just look at the weekly thing on what actually you have done. Okay, I was part of a team. I was in a real estate industry just for a few time there, but I will go back there because I like it, And then what I found there is that they actually emphasize on the meetings. On the meetings, like we will hold the meetings every Monday in the morning. They will emphasize them. In other words, they will even make sure that even if you can miss anything, you don't miss that meeting because it's very important. You have to look at your progress. We have to talk about what we can do. We have to, you check on your progress, you check on what you need to do. All right? And Mr. Mutsoleri has a point on that one, okay? To say that he doesn't believe that they do have these meetings. And because if they do, they will be seeing these challenges. And they will be even reporting to him that, listen, I've got challenges of this kind, and it seems like we won't be able to, solve them. Guys, if you ask me, and if you are a person who's been appointed, and in your mind, in your heart, and you are not looking at the money, you are not looking at the salary, you are saying to yourself, you know what? I know that I cannot do this thing. I know that this thing is going to be difficult for me. Let me not take this job, or let me go to the minister, or go to whomever that you're supposed to report to and tell them and tell him or to tell her or whatever to say, listen, I'm not going to be able to do this thing, okay? Please, you can appoint somebody else. But people, they take jobs even if they know that it's not going to work for them. And then they stay there. And then when they get to the realities of things, they find themselves not doing the job. And because of the salary, because of the money, people, they stay there. They mess up the whole thing. And unfortunately, if people mess up things, those people that are going to be capable of doing it, when they come there, they find it more damage than before. You see? So people, they have to be honest. I don't know. And I know you guys, sometimes you've got your families, you've got whatever you're thinking about your families and everything like that, and then blah, 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 and all of that. But anyway, that's what I'm saying. He has a point there, okay? The management has to do better things, okay? They have to do it. And unfortunately, guys, sometimes you have to be honest. For me, I think when you go to these hospitals, I don't know about public, but especially, okay, I'm not saying private, I can say all hospitals sometimes. Sometimes I would have this feeling of saying, when a person comes there and maybe they are sick, it seems like, I'm not saying they are doing it. Please, guys, I'm just saying because I've never been in hospitals a lot of time, and I've never visited people in hospital for a lot of time because I don't have a lot of people that actually, that are close and, but 1-2 times I've went there, sometimes I would feel like, sometimes they look at you, and they are like, this one, I'm just thinking, even if you are sick and then they look at you, they are like, and these things, guys, I don't know how helpful this thing that they do have in hospitals, especially, I don't know whether it's especially in private hospitals or also it's there in public hospitals, where you see they say there are levels in hospitals. Level one, maybe it's not critical, it's just the person who is sick who can still walk, and then you've got the critical person. Sometimes, I don't know, sometimes you take a person and you see that they are not okay, but you calling them or diagnosing them to say, well, you are not that bad, okay, you can stay there. Or some of them, they can take them and send them back home. And then they come back again in 3-4 days time. They are critical now. They are critical. And when they took them back home, they didn't give them anything. They said, okay, no, I think you are okay. We'll just give you 1, 2, 3, and then you go home. And then when a person comes back, it's more worse than before. And then, and all of it. I don't know how helpful this thing of categories. Well, I do understand that they are trying to manage, okay? So that we don't have a critical person waiting for a person who's not critical, and then they end up like losing their lives because we were waiting for the person who was not critical. I do understand all of that, okay? But maybe it's a good system and maybe it works. I don't know. But anyway, let's continue with Mr. Mutsoleri.
when that hospital was built, when it was opened officially, I was there. It was one of the best. It was one of the best. I was there. And in my speech, if you were to retrieve it, I made the statement that for it to be one of the best, we need the management to be on their toes all the time. Very clearly, it means that didn't happen. Because they had facilities which many other hospitals didn't have. We were celebrating it. So there is failure of management. Coming to, so Prof, I am happy that we have already selected medical staff that must be referred for professional misconduct. Okay. This cannot be allowed, and it cannot be supported at all. And I hope, I'm wondering, Prof, why some are referred for training. They've been trained, they've passed. In-service training is important, but I'm not sure whether we should sentence people just for training when they've done something that is so grossly wrong. My own thinking is that I would like to refer the whole staff to the Health Professions Council and the Nursing Council. They are the ones who will determine professionally whether what happened is right or wrong, because it's not acceptable to me. I don't want to boast, but I haven't practiced for 30 years now. But I don't think I'll do this type of failures. If you were to put me in a hospital today, I think I can do better. And yes, and I don't think this is something that we should encourage and allow to continue. Now, coming to the issues of infrastructure, it's quite unfortunate, Prof. Many of you were not there, may not have been there. Maybe let me say all of you here in front. I was there all the time. It was unfortunate when this hospital was built. It was chaos. In fact, some people are serving jail sentences because of what happened when Kimberley Mental Hospital was built. I went there several times. One of our top engineers even found that a building which does not have one story only, does not have a foundation at the bottom. This was found by senior engineers those years back. And that's why some people are serving jail sentences. And I was hoping, because we did send engineers there, that they will understand those issues. Now, on the issue of electricity, perhaps we should mention today, for people who steal cables and vandalize them, that they must know that they are also committing murder. In the instance, it's not just theft, it's absolute murder. And I was hoping the courts will realize that. But having said so, Prof, I cannot but express my disappointment about the fact that when thugs vandalize systems, the hospital was not able to respond. I'll tell you why I'm disappointed. When load shedding started in Eskom the first time, Eskom told us very clear that they are not going to spare hospitals. The load shedding that started recently, I think, was the most recent one. But the first time of load shedding in Eskom, I just don't remember the year. Around 2014, 15, if I'm not mistaken. We debated with Eskom and asked them. They clearly told us they won't spare hospitals. So one could foresee what was going to happen. What we did then was to put a group of engineers. We had a very, very competent, hard-working engineer here, who unfortunately we lost to COVID, Dr. Masood Shaka, who was doing very well. He set up, at our instruction, a group of engineers who went hospital by hospital, where they were assessing how many generators do they have, are the generators adequate, should we buy more generators, if there is load shedding, Can the hospital stand on its own? Can areas that are sensitive, can they be protected? Can we restore electricity there? And that report was very, very comprehensive. And further on, we said each and every hospital must choose a special person, because those hospitals which had generators, some of them, like it once happened in one hospital in Limpopo, where when the nearest transformer busted, they thought it's load shedding. They just switched on the generator. It ran and ran until it ran out of diesel. And you know, there were complications with patients. So we said each hospital must have an individual whose job is to check the generators regularly. He said that regularly, to make sure that there is enough diesel, even if there's load shedding, just to start the generator, to make sure that if there is a problem, the generator will start on its own. Because if there's no load shedding for a long time and you are keeping generators, you may find that some of them are faulty, and you discover when there's a crisis. We did that and said each and every hospital, we even asked that that person must keep a record that they went to check the generator on this day, there was so much diesel, they went to restart it on this day, it started on its own, etc., etc. We did that also because there were problems at Chris Hani Baragwanath Hospital at some stage about generators. Now, for vandalism to occur years later and find that the hospital cannot stand on its own because the shortage of electricity. Not surprising, Prof, that the nearer private hospitals were affected in the same way but could stand it. Obviously, they had people who were taking care of this. That's why I'll call it clear failure of management. Even on issues where we have given guidance that please take care of your...
Yeah, I think, I'm sorry, but comparing private hospitals and public, I don't know, because private, we all guys, the advantage of private hospitals is that they don't have a lot of people there. They don't have the majority of the people going there. Okay? It's only people there and there. That's why sometimes you find them even not working, but you find them relaxed, going around, you know, drinking tea, going to the shops, because it's not hectic like that. But in public hospitals, guys, it's very hectic. That is why, for me, I believe that in public hospitals, they should be better than private hospitals when it comes to responding to things. Load shedding, responding to generators, taking care of them, whatever. It should be actually more competent. It should be more competency in the public hospitals than in the private. They should not be beaten by the private hospitals. But as I said, the private hospitals, they've got an advantage of not having everyone flocking there or going there. But in the public, guys, it's always full, okay? It's always full. So sometimes, but I also take his point when he says that when it comes to the generators and taking care of the generators, I thought that was a common cause. If you've got a load shedding, and also if you've got maybe these things of cable theft and everything, these people who are stealing cables, guys, they are killing us. I don't know what is wrong with them, and I don't know how do they benefit on this, and I don't know how do they make money with these cables or whatever. I know that some of them, maybe they are making a lot of money, but it's killing people. It's just nonsense. It's just, if the police or if these guys who are dealing with these things, they can deal with this thing decisively, and they can just chop it off and just make sure that it's no longer there, I'll be very happy, man. You know? Because sometimes when people experience electricity outages, it's because people are stealing cables. And there's nothing that those who are fixing electricity, they can do. They have to follow whatever that they need to follow to fix it. But the people who are stealing these cables, what is wrong with people? You see them even on the videos. On the videos, people are sneaking there, pulling out a cable. What is wrong with people? You know? But anyway, I do understand him, but in terms of comparing the private and the public, I would never do that because it's not the same thing in terms of population in this private and public. Okay? But I also take the point that they did try to, they did actually advise people to do 1, 2, 3. And he makes a very good point when he says that there must be that specific person who takes care of those generators. It's unfortunate because people, they fight for tenders. Nah, it's my tender. No, I will give it to my friend. No, I will give it. And you find that your friend is incompetent. Let me give you an example. At home there, we wanted to put some cupboards in all the rooms, right? And then we look at that. Now, because we are people now in let me make an example of Mpumalanga. In Mpumalanga, we are looking for somebody to put some cupboards. Now, in our minds, we are like, okay, we want to support somebody who is local, which is a good thing, right? That's what you will expect. Okay? Then we say, okay, let's look for someone. We find somebody somewhere in Mpumalanga, Kwandebele there, right? And we want him to actually put cupboards at our home in Kwandebele there, in Mpumalanga, right? And then we asked him, and then we spoke to him. We told him that, listen, don't worry about any money, just tell us what you need. We spoke, and then he went, and then he went and ordered things and everything, and then he came back, then started to put the cupboards. Hey, I can tell you that guy put cupboards, and then the next thing he's making calls, telling us, we need more of this, more of that, we need this and that, and then the next thing the person is disappeared, like he's just disappeared. He did put, but he's not finished. Where he was supposed to do the full work, he was not doing the full work. I told them at home, I was like, that is why I don't trust these people. I don't trust these people that we want to support because they are black, because they are not doing the right job. Listen again. I'm not saying all of them. There are those that are doing wonderful, powerful job. But unfortunately, when you find those guys, or when you look for those guys who will do the great job, you find them in towns. Now you have to bring them in Mpumalanga. They have to work there in Mpumalanga, and sometimes there are maybe some of the things, and it gets expensive also, But those guys that you try to help, to give them maybe jobs at home, they're doing a mess. They are doing nonsense. That guy, I even spoke to him one day when I was at home. I was like, listen, my guy, we trust you. Okay, don't disappoint us. Okay, and we do understand that maybe there are some technicalities there, and maybe there are things that, but please tell us so that we know. Don't just disappear, and when we call you, we don't find you. I don't know how people are doing business. And then he ended up disappearing. We ended up trying to find somebody else. And then you want us to trust people that we think that this thing, guys, of wanting to support people because they are black, because you want to support their home business, they do a mess. I'm not saying all of them, but some of them, they are just a mess. They don't know how to run a business. I don't know how do you want people to trust you if you are running a business like that. Anyway, that was just an example. Okay? And Mr. Muts already does say here that there are people that we've put there that we thought they will do the job, and people are not doing their job. And,
take care of this. Have a special person whose job is to take care of the generators. It means in this case, it did not happen. And that's why I'm saying it's multi-system open failure, because then comes the unexpected clinical failure, even just to know that a mentally ill patient with pneumonia cannot be referred back to a mental hospital or to the surgical unit as such before the pneumonia is treated and fully treated. Anyway, I am happy that some of the problems, Prof, has already been resolved, like the hiring of nurses. I know it has started. But there's another issue that I cannot fail to mention. The issue of buying linen. You said there must be a forensic investigation, Prof. On procurement. I am disappointed about this. MEC, unfortunately, you are not there. You won't know. But your predecessor, the previous MECs, should know. On this issue of good quality pajamas, other garments, and all that, you should know. Because, Prof, the Department of Labor has established a unit here in Silverton. And from there, they establish units in all the other provinces, except Mpumalanga. All the others have got that units. Those units are meant by people living with disabilities. And they are producing these things. They are producing garments, pajamas, etc. Very well. Even at the end of May, I went there to check again and found them still producing and doing very well. And I talked to the Deputy Minister. I didn't send her, she doesn't report to me, the Deputy Minister of Labor. I asked her if all the other units in all the other provinces are still okay. And she said, yes, they can still produce. But then how do we go and order to a company that is going to cause us this type of embarrassment when the state itself has got areas where I would like to tell the country that after the spectacle at Helen Joseph Academic Hospital, I asked the DG to put all heads of departments together to find out the shortages on these issues. Because we mentioned the beds, linen, mattresses, pressure mattresses for people who have got stroke, etc. And I said each and every HOD must give a list hospital by hospital where there's a shortage. That list was given, and we discovered that we need to buy 1.4 million articles in that regard. And it's going to cost us 1.3 billion. When the Minister of Finance was reading the budget, I'm sure you are aware that he gave us an extra 6.7 billion to move away from austerity. We are aware and we accept that there was austerity for about a decade. Austerity in health that caused some of this problem of shortage. But the minister said he wants us to have a start, because it's just a start. We've got 6.7 billion. I called all the MECs, sat with them, the deputy minister, in the National Health Council to decide what we are going to do with this money, 6.7 billion. One, to hire 1,200 doctors. Two, to hire 200 nurses. Three, to hire 250 other healthcare workers. That's the first thing we want to do with this money. Secondly, to buy the 1.4 million articles. That will be the pajamas, bed sheets, etc. And they will cost 1.3 billion. 2 weeks ago, I called all the MECs, even more urgent. I said all of them must go and procure this from the Department of Labor. Enterprise. It is there, and it's very cheap. Rather than going to be exposed to poor companies like this one. I haven't shown the type of pajamas or linen they are producing, but the fact that the Ombud could get that's poor. Why should we go on when the state itself, this tropical enterprise, I don't know who they are. I don't know who they are, but the disabled people there produced at very reasonable cost, and I can assure you the material is good, anybody can go there. I asked Treasury to allow us, MEC, that this money must be a conditional grant. Treasury refused, and they said it's going to be an equitable share to be sent to provinces, which means they can do anything with it other than these things I'm asking. So they said I must go and negotiate with MECs. I did. MEC, unfortunately, you couldn't attend such a meeting. I don't know whether they reported to who. That we are saying, once this money is given, even if it's given to provinces directly, they must go and purchase this thing at the Department of Labor enterprise being produced by people living with disabilities. Every province can be able to do that except Mpumalanga, which can come to Silverton directly because they do not have it. There won't be any excuse if this doesn't happen. I can see here there is a shortage of professional nurses. I think among the 200, there will be a quota for the Northern Cape. They ought to be able, it's a very small number. But remember, we are just helping at the national level. The issue of budgeting for hiring of staff is a provincial matter. So the province itself must go back and look very seriously into this issue. But all in all, Prof, thank you very much. You have done your job. What I will then do, I'll get the National Mental Health Review Committee, chaired by Professor Solura Taemani, the former head of psychiatry at Sefako Mahatu. We'll have to pay a very good visit. I know they've been there after these events, but after your report, I think I'll ask them to go there. I'll love to go with them, but they've already been there to re-look at the whole situation, because I think we need to restart again what's happening in the two hospitals to reverse the multi-system organ failure. Thank you very much.
Yeah, so I don't know, guys, what do you think about that? Obviously, it's disappointing, you know, when you see these things, especially when it comes to this part of our society, not part of our society, part of our institutions, or these institutions like, you know, healthcare institutions. It's so disappointing, because that is where actually things should be done very well. That is where you should be actually finding competence, and also finding people who are serious, you know. And guys, what we all also need to understand, I believe that, you know, when it comes to ministers, you can be a good minister, and you can be a good minister from a distance, okay? But if you are a good minister and you've got a bad team, sometimes your bad team makes you look bad, you know. That's why it's very important for you, when you are a minister, you get a good team, not your team, but the team that it's not. I don't know how to put it, but the people that you appoint, I don't know if the managers are appointed by the minister, but if they are appointed by the minister, those that you appoint, make sure that you appoint people that are going to be in the same vision mind, or the same mentality and enthusiasm, you know, in terms of dealing with issues, in terms of doing the work. But if you're going to find people who are just there just to get the salary, they just want to take care of their families, they don't care about what is happening, just do 1, 2, 3, they take shortcuts, they take bribes, they take all these things, then you will have a problem. Okay? You will really have a problem. That's why even if you look at good ministers, they've got good teams. That is why even with the president of USA, the president of the US, Mr. Trump, when you hear him every time when he announces something, or they're talking about something, he always mentions his team. He says, I've got a good team. He knows that he has appointed people that are competent and people that will do the job. It's not about you just appointing somebody. It's just appointing someone that will do the work, do the right, especially in these key positions. Don't appoint a person because you are trying to balance the what there, and then you are balancing your balance of the person that you choose is wrong, and then they do all these things, they mess up things. Okay? Anyway, I don't know, guys, what do you think about that? You can put your comment in the comment section. Tell me what do you think about this report, and tell me what you think about what I've said about the foreign nationals. You know, if they don't find South Africans, they can appoint the foreign nationals and all of that, guys. And those who can be able to work in hospitals, just avail yourself, guys. You know, otherwise they will appoint the foreign nationals. Then you'll come complaining, running here. And then because you're not availing yourself, you know, it will be another thing if they are rejecting you because they want to put someone who is from outside. Okay, but anyway, tell me, guys, what do you think about that? I hope that while you're watching, you will like the video, subscribe to the channel, and I really appreciate that. Now, ladies and gentlemen, you have a good day. Now, ladies and gentlemen, you have a good day, and guess what? We are done and I am out.